In late summer 2024, California health officials confirmed a human case of plague in South Lake Tahoe, a disease many thought belonged to history. The news sent ripples of concern through the community, as most people associate plague with medieval times, not modern-day America. Yet here it was, making headlines in a popular vacation destination. The patient, after experiencing severe flu-like symptoms such as high fever, chills, and fatigue, was quickly hospitalized. Thanks to rapid diagnosis and prompt treatment with powerful antibiotics, the individual made a strong recovery. This case highlights the importance of modern medicine and quick action in preventing serious outcomes from diseases that once devastated populations. This case sparked immediate action. Health teams launched a thorough investigation to trace the source of infection. They focused on the patient's recent outdoor activities, including hiking and camping, and looked for any possible contact with wild rodents or their fleas, which are known carriers of the plague bacteria. Surveys began around Lake Tahoe, with teams testing local rodent populations and monitoring for sudden die-offs, classic signs that the plague bacteria, Yersinia pestis, might be circulating in the area. These efforts are crucial for early detection and prevention of further cases. The goal was clear: protect not just one patient but the entire community and the millions of visitors who flock to Lake Tahoe each year. Public health officials work to ensure that everyone, from residents to tourists, remains safe and informed. The Lake Tahoe Basin's lush forests and abundant wildlife make it a natural habitat for plague-carrying rodents like squirrels and chipmunks. These animals can harbor fleas that transmit the bacteria to humans and pets, especially during warm months when outdoor activity peaks. For both locals and tourists, this is a call for awareness, not panic. Simple precautions, like avoiding contact with wild animals, using insect repellent, and keeping pets away from rodent habitats, can dramatically reduce the risk of infection. Education and vigilance are key to staying safe. California and Nevada health departments are working closely together, sharing information and resources to keep the public informed and safe. Their coordinated response includes distributing safety guidelines, holding press conferences, and monitoring the situation as it develops. While the word plague sounds alarming, today's reality is very different from the past. We now have effective antibiotics, advanced medical care, and strong public health systems that can quickly contain and treat cases, preventing widespread outbreaks. This case is a powerful reminder that nature's beauty sometimes comes with hidden risks, but with knowledge, preparation, and a little caution, we can continue to enjoy the outdoors safely and responsibly, appreciating all that Lake Tahoe has to offer. Human plague cases, while rare, are not unexpected in the American West. This region, with its vast wilderness and unique ecosystems, has long been a place where the natural world and human activity intersect in surprising ways. The bacterium Yersinia pestis, which causes plague, quietly circulates at low levels among wild rodent populations in states like California, Arizona, Colorado, and New Mexico. These rodents, such as ground squirrels and chipmunks, can carry the bacteria without showing obvious signs of illness. The Sierra Nevada, including the picturesque Lake Tahoe region, is a well-documented hotspot for plague activity. Here, the combination of wildlife, climate, and human recreation makes occasional human cases possible, especially during warmer months when people spend more time outdoors. Most human cases occur in rural or semi-rural areas, where people are more likely to come into contact with infected rodents or the fleas that feed on them. Activities like hiking, camping, or even living near rodent habitats can increase the risk. This pattern is well known to public health officials who actively monitor rodent populations and post warnings in affected areas. Their vigilance helps prevent outbreaks and keeps the public informed about potential risks. Fortunately, plague risk is highly localized. Urban dwellers face almost no threat, as the conditions that support plague transmission are rarely found in cities. Signs in parks and campgrounds advise visitors to avoid contact with wild rodents, never feed them, and to keep pets leashed to prevent them from picking up infected fleas. These simple steps are effective at reducing risk. The recent case in the Lake Tahoe area fits this established pattern, serving as a reminder rather than signaling a new epidemic. Such cases are rare but not unprecedented. Understanding where the risk lies empowers people to enjoy the outdoors safely. Using insect repellent, staying on designated trails, and being aware of posted warnings are simple precautions that make a big difference. Ultimately, awareness, not fear, is the key to exploring the West's wild beauty. With a little knowledge and preparation, everyone can experience the adventure and wonder of these landscapes while staying safe. Plague spreads through a natural cycle between wild rodents and their fleas. Fleas bite infected rodents, pick up the bacteria, and can then transmit it to humans or pets. The most common route, a flea bite during outdoor activities in plague-prone areas. Sudden die-offs of rodents can drive hungry, infected fleas to seek new hosts, including people and pets. Direct contact with sick or dead animals is another, less common risk, especially for hunters or veterinarians. Cats are particularly vulnerable and can transmit plague to humans through respiratory droplets if infected. Person-to-person spread is extremely rare and only occurs with pneumonic plague. Modern medicine and rapid response make such transmission unlikely today. The main risk remains: flea bites from wild rodents in certain environments. Plague appears in 3 forms, depending on how the bacteria enters the body. Bubonic plague, the most common, starts with a flea bite and causes swollen, painful lymph nodes called buboes. If untreated, it can progress to septicemic plague, where bacteria spread through the bloodstream, causing severe symptoms and tissue death. The most dangerous form is pneumonic plague, which infects the lungs and can spread through cough droplets. Pneumonic plague develops rapidly and can be fatal within days if not treated. All forms are medical emergencies, but antibiotics are highly effective when given early. Person-to-person transmission is only a concern with pneumonic plague, but it's rare. Early diagnosis and treatment are critical for recovery. Thanks to modern medicine, most patients survive. Recognizing symptoms quickly saves lives. Plague is exceptionally rare in the United States, with only about 7 cases reported annually. Nearly all occur in rural western states where wild rodents carry the bacteria. For most Americans, the risk is extremely low, far less than many everyday hazards. Public health education and urban development keep people separated from rodent habitats. Simple precautions like avoiding wild animals have greatly reduced exposure. When cases do occur, prompt antibiotic treatment leads to high survival rates, nearly 90%. Large outbreaks are virtually unheard of today, thanks to modern sanitation and surveillance. A single case triggers a swift public health response to prevent spread. Plague is serious, but widespread fear is not justified. Today, plague is treatable with antibiotics like gentamicin, doxycycline, and ciprofloxacin, especially when started early. Doctors in the West are trained to recognize symptoms quickly, ensuring fast treatment and recovery. Prevention focuses on breaking the chain of transmission, monitoring animal populations, treating rodent burrows with insecticides, and posting public warnings. Individuals should avoid contact with wild rodents, never feed or touch them, and steer clear of areas with rodent die-offs. Use insect repellent with DEET, and wear long pants when hiking or camping. There's no commercial plague vaccine in the US, so prevention and rapid treatment are key. Public health departments act quickly if plague is detected in animals, protecting communities. The rarity of human cases means mass vaccination isn't needed. This two-pronged approach, prevention and treatment, keeps plague rare and manageable. Awareness and quick action are our best defenses. In regions where plague is a risk, adopting a few simple habits can make a big difference in keeping you and your loved ones safe while enjoying the outdoors. Awareness and preparation are your best tools. Always keep your distance from wild rodents and other animals. Teach children not to touch, chase, or feed squirrels, chipmunks, or any wild creatures, no matter how cute they seem. Observing wildlife from afar is both safer and more respectful. When camping, choose a site away from rodent burrows, nests, or any signs of animal activity. Inspect the area for droppings or holes before setting up your tent, and keep food sealed to avoid attracting animals. Protect your pets by using veterinarian-approved flea control products regularly. Keep dogs on a leash during hikes, and in high-risk areas, keep cats indoors to prevent them from hunting or bringing home infected rodents. Remember, a sick pet can unknowingly bring plague into your home. Monitor your pets for unusual symptoms and seek veterinary care if they seem unwell. Their health is directly linked to your family's safety. Make your property less attractive to rodents by regularly clearing brush, keeping grass short, storing firewood off the ground, and using rodent-proof trash cans. These steps help prevent rodents from nesting near your home. If you find a dead rodent, never touch it with bare hands. Instead, call your local health department or animal control for proper removal and advice. Handling dead animals can be dangerous. After spending time outdoors, be alert for sudden symptoms like fever, chills, or swollen lymph nodes. These can be early signs of plague or other illnesses. Don't ignore these warning signs. Seek medical care immediately if they appear. When visiting your doctor, always mention any recent outdoor activities or possible exposure to wild animals. This information helps your healthcare provider make a faster, more accurate diagnosis. Early detection and treatment are crucial for the best possible outcome. Prompt medical attention can make all the difference. By following these simple precautions and staying vigilant, you and your family can safely enjoy all the beauty and adventure that nature has to offer. Respecting wildlife, practicing good hygiene, and staying alert will help keep everyone safe and healthy during your outdoor adventures. The Lake Tahoe plague case is a reminder that ancient diseases can still surface, even in modern times. Public health's goal isn't to create fear, but to encourage respect for nature and informed action. Plague remains extremely rare in the U.S., and our healthcare system is well prepared to handle cases. Awareness and simple precautions, avoiding wild rodents, using repellent, protecting pets, are highly effective. Public health agencies and healthcare providers remain vigilant, while individuals can adopt safe outdoor habits. These small steps let us enjoy America's wild places with confidence. The message is vigilance, not fear. Explore, hike, and camp, but stay informed. Understanding how plague spreads and how to prevent it empowers us all. Respect nature, take sensible precautions, and trust in modern medicine. With knowledge and awareness, we can safely enjoy the beauty of the American West.